seriously, MRIs do not cost $2,000. A lot of these imaging centers have a menu.
Let's talk about the scam of insurance. So in this case, the provider sent for an MRI. Patient goes for the MRI. There's a contracted price between the insurance company and the provider. Provider sends the bill, says, hey, we're going to charge $2,200 for this MRI. Insurance company says, cool, well, we negotiated a price of $2,000. So that is what you can charge that patient. Before deductibles went skyrocketing and everything just went towards deductible, that insurance company would generally pay for a portion or most of that $2,000 bill, the price that was negotiated. Now that deductibles are high, that $2,000 cost is passed on to the patient. Here's the plot twist. It doesn't really cost that much for an MRI. That is the problem. If you go on to the places that generally provide the MRIs or like do the scan, have the machine, etc., they will only charge $300, $400, $500, $600. It depends on the place that you go. But the only way to get that price is to pay out of pocket and not use their insurance at all. Here's one more level to this, is that if you have insurance, the provider or like the healthcare building and company is legally obligated to bill your insurance. So if you want to pay out of pocket, you have to ask them to like not bill your insurance at all, although they're most of the time obligated to send that off, therefore trapping you into having to pay this $2,000 cost instead of the out-of-pocket cost, aka not using your insurance, that's like $400. That's the problem, is that these things are negotiated to that level, and we as the patients, I'm a PT, but I'm still of course a user of the system. That's what we're dealt with. And so it's not really our faults, it's the system's faults, but yet it is our responsibility as patients and providers to demand a better system. Let's do that.